Hello everyone, thank you so much for tuning into our live session today. My name is Ri Wern, your CARiNG Pharmacist and your host for today. I hope everyone is in good shape. Even though COVID-19 restrictions are not as tight as before, however, we should still remain vigilant for our own health and well-being. It has been worrying to read the news about all the infectious diseases that have been going on within our communities, especially hand, foot and mouth disease among children. Hence, that's why it's best to take precautionary measures for our own safety as well as your little ones. If you have been having concerns about neither your own or your child's immunity, you are in luck today because we've got an expert on board with us to discuss probiotics and how to choose a good and reliable one. Our expert guest is a consultant pediatrician from Dr. Chin's Children's Specialist Clinic Kapong and ABC Children's Specialist Clinic Bandar Utama. He has extensive research and working experience in this field. Also, we will be having a surprise giveaway for 5 lucky winners to win CARiNG cash vouchers worth 50 ringgit each. So be sure to ask your friends and family to join our live stream now. Without further ado, let us welcome our guest for today, Dr. Chin.
Hi, thank you everybody. Thank you Ruben for your introduction. Hi everybody, good evening. How are you all?
Thank you, Doctor. It has been our pleasure having you tonight. How have you been doing?
I'm good. Yeah, I'm very happy to be here to share with you my experience and knowledge in choosing the good and reliable probiotic.
As a pharmacist, I always have a lot of customers asking me about prebiotics and probiotics. What are the differences between them? Because that sounds very similar. Doctor, would you mind to explain to us what are the differences between these two before we step into our topic today?
Sure. I think, yeah, you are correct. In my clinic, also many parents ask me, what's a prebiotic, probiotic? Then I tell them, do you know what's antibiotic? Yeah, in fact, bio means something lively. So antibiotic, something against the life. Antibiotic, as you all know, okay, to kill the bacterial infection. But the thing is, don't simply take antibiotic because antibiotic will kill the good germs in our gut. So our good germ, in medical term, we call probiotic, something something flavor the life, probiotics. So basically, probiotic is a good germ that stay in our gut that give us some benefit to the gut health. All right. Then to make this probiotic or good germ to survive in the gut, you need to feed them. You need to feed them the food. So the food for the probiotic we call prebiotic.
Ah, I see. Wow, interesting, Doctor. Yeah. Before we proceed with our discussion, be sure to stay tuned the end of our live session today because we'll be giving away 5 CARiNG cash vouchers. For the winners, we have the most accurate answers. All right. So our topic for today is how to choose a good and reliable probiotics. Firstly, I would like to ask Doctor these very important questions.
All right.
Especially for our audience who would like to win the giveaway.
Okay.
All right.
Okay.
Doctor, can you please explain what is gut health and why is it important in relation with immunity, especially in times of COVID?
All right. I think many recent research found out that the gut is not simply just an organ for digestion. It digests and it absorbs the good nutrient. It will throw out all the waste by poo-poo. But at the same time, they found that 70% of our body immune cell, okay, what we call the white blood cell, the soldiers fighting the germ, actually stay along the gut wall. So that make this gut actually is the biggest organ for the immunity maturation.
I see.
So this implies with the child with the good gut health, they have a good immunity. Okay, then what are the things or factors that actually make this gut health mature? This white blood cell mature. So from the study, it shows that the probiotic that stay along the gut wall, they have a kind of internal talking, internal communication to make the immune system mature. Mature in the sense of these soldiers along the gut wall to fight whatever germs the enemy come to attack us. So you won't down with infection. But other way around, it also will modulate our gut wall immune system. Don't simply fight because something what we call harmless substance, we call allergen, like cow's milk protein, whatever seafood protein. Hey, you don't fight. This is a nutrient for the child to grow. If you fight, will become allergy. So this gut health is very important. You must strike the balance. Means what we term that microbiota must be balanced. The good germ must be more than the bad germ.
I see. Wow. Okay. Now that we know the importance of gut health, what is the meaning of good bacteria in the gut?
Okay, good bacteria by definition by the WHO, World Health Organization, not all the probiotic is the same. The probiotic that defined as a probiotic, it must confer the good health benefit to the host. Otherwise, you simply take a food, like for example, okay, whatever fermented food, like yogurt, okay, it has a probiotic, but the thing is the probiotic not by the number enough to confer the good health benefit to the host. You cannot simply say, hey, this is a probiotic. You must have this definition there that actually give the good health to the gut, to the host itself.
I see. Okay. As next, I would like to ask, is there a relation between maintaining a good gut microflora and optimizing immunity?
Yes, like just like I mentioned, to maintain this immunization, this immunity, right? You cannot over fighting, that become allergy. Okay, you don't under fighting, the germ will win. Then you down with the stomach flu, vomit, and diarrhea, and so on. So you must actually modulate your immune system, which you all know. Children after come out from the mother's womb, they have to fight the germ around them. So they must actually learn how to fight. But to train these soldiers, you must send them for a course. Okay, something like or whatever training course, whatever course. So to train these guys, all this germ, to train all this immune system, the trainer is the probiotic. The whole probiotic we call microbiota, that really closely related to the maturation of your children's immunity.
As for parents who would like to care for their children's immunity, how do we choose suitable probiotics for our children, and what factors should it be based on?
All right, this is also very, very common question. Okay, okay, you want to buy, let's say, for example, a car. Okay, there must be a factor for you to think, to consider. Okay, what suit you the best. Okay,
yes, definitely.
Probiotic also the same. But only thing that probiotics now in the market, so many. You can name it. I think you walk into any of pharmacy shop, I think more than 20 brands are there. Okay, from a direct selling, from a pharmacy, from retail, from clinic, and so forth. So again, I tell the parents, the brand name is not really important. Important the raw material. The raw material, the probiotic strain has been studied widely in the world. Then how do we know? Usually the probiotic has been studied in the clinical research. They carry the name, the genus name, the species name, and the code. Okay? For example, for me, I'm Dr. Chin Wai Seong. I have a surname Dr. Chin. Then Wai Seong, okay, is my name. Then I established since the 2001. So there's a code for me to establishment. So this probiotic also the same, have a genus name, species name, and with the code. Then this is a reliable source of the probiotic. Number two, the clinical study, it shows that this probiotic can survive outside the body, which in the dormant, sometimes they make it to a spore. Okay, so they won't get activated. Because once the probiotic get activated, they must reach to their destination. They mean our colon and the gut. Okay, otherwise they get activated in the room temperature. Whatever you take in is nothing. It's not viable anymore. So that means this raw material must be studied that can stay outside the room temperature. But some probiotic cannot. They have this no technology to make them dormant. They must be kept in the fridge. Then you must follow instruction.
I see.
Third, this probiotic must be studied that when you ingest through the oral, go to the stomach, this probiotic must resist the killing effect of our acid, because our stomach acid very strong. Then at the side there's a bile salt will come in. Okay, all this actually is kind of a defense mechanism in our gut to kill all the bacteria. So this is also bacteria, but it's a good bacteria. So they must actually sustain and resist all this insult. Okay, then successfully reach to their destination. That's our gut. Okay, that only they can confer all the benefit to the host. But without this factors, you simply take probiotic like this, I will tell parents, you are taking the money only. No, it's a wastage.
Yes, exactly. That's a very good point, Doctor.
Yes.
As we know, probiotics are microorganisms that generally improve the gut flora.
Yes.
So, doctor, is it true that the higher the CFU, the better it is for children.
Yeah. For human, you know, everything want to fight for the numbers, okay? In fact, last time I did one live, you know, I told parents, okay, in this world, if let's say no number, such a good thing, such a wonderful world. Not like force your child, number one, okay, you raising also number one, okay, but without number also cannot. Otherwise, the police cannot catch a speed trap or 110 km per hour, okay? What about sugar level? It's too high, okay? This must have a definition,
Yes.
even our temperature, body temperature. So about this CFU, we call colony forming unit. Okay, some parent will ask me also, is that the highest the better, the number? I will say no. Again, go back to basic, which I mentioned just now, okay? Whether this raw material, probiotic, has been clinically studied, okay? Whether this probiotic can go through our bowel salt and the stomach acid, the killing effect, and successfully reach to their destination. Otherwise, give how many billion CFU also wasted. Yes.
So if children want to take probiotics, can they take for longer term? Or are there any long-term implications that parents should be aware of?
Okay, probiotic is something pro for life. So if you take for long term, it should not have any side effect to the host or to the body. But only thing you ask me, should the child take maybe not probiotic, any supplement?
Yeah.
So as a general rules, as a doctors, right, we will advise so-called balanced diet. Balanced diet means all the categories of food you take, carbo, fat, protein, and the mineral, vitamin C, and so forth. But the thing is, if let's say the child, okay, lacking of certain this vitamin or this substance, for example, probiotic, like for example, in the condition of having diarrhea, vomiting, poor appetite, sometimes suffer from constipation, and sometimes because no choice, doctor have to give antibiotic to kill the bacterial infection. It might at the same time kill the bacteria and the good germs in the gut.
Yes.
So that time, to reduce the risk of diarrhea, then we will supplement them with a probiotic. So in other words, if you ask me, the child can take long-term probiotic or not? Can. Okay. Then can the child or must the child take the probiotic for long-term? If for me, the neutral answer, I don't think it's necessary. If the child is healthy, right, should be no problem. Unless the child always, okay, have the bad gut health, which I mentioned just now, constipation, diarrhea, which can affect the immune system, then you can supplement the probiotic, the reliable, clinical studied probiotic.
I see. Doctor, would you recommend to take probiotics with antibiotics for quicker recovery and also for gut health?
Okay, which I mentioned, anti and pro, something like dynamo. You want antibiotic and probiotic, okay. All right. As we know, first of all, I would like to emphasize, okay, not all high fever that during this sickness are due to the bacteria, okay. In fact, in the children with the high fever, 90% caused by viral infection, okay. Only 10% caused by bacterial infection that need antibiotic. So hope parents don't simply ask doctor, give antibiotic can get fast recovery. It's long concept, okay? But no choice. Sometimes you have a bacterial infection, especially the children with the tonsillitis, or maybe otitis media, the media infection, or sometimes urine tract infection. Not hand, foot, mouth disease. I have patient ask for antibiotic for hand, foot, mouth disease, for COVID, for influenza, wrong, or dengue. Okay, so bacterial infection only 10%. So in such case, when we prescribe antibiotics, we know antibiotic will kill the good germ or probiotic in the gut that causing the diarrhea. Because
hello, welcome back everyone. We are terribly sorry for the technical issue that we experienced just now. So to make it up, we're going to repeat the questions so that we all know what the doctor explained just now. Okay. So the first question is, doctor, how do we know the probiotics that we are giving to the kids are effective for them?
all right. So hopefully the parents stay tuned. Never mind, we still have more time. I think due to technical issue, I will answer the second time again. Never mind, you listen second time, then you can memorize more. Okay. So for the parents' sake, right? So how to know this probiotic is effective for the child? I think at home, the parents actually can judge by seeing their growth. Okay, the weight and height. Number 2, the appetite is good. Number 3, their poo-poo. Okay, that means their shit lah. Okay, not hard and not soft. In fact, you can Google the Bristol stool chart. Usually, doctor use a Bristol stool chart to
see which type of poo-poo is considered normal. Usually we use take type 4, the type 4, okay? So some parent might ask, how can we check the poo-poo, the probiotic and prebiotic? Actually, we can't check. You really want to check is in the research lab. You send the poo-poo for the how many numbers of probiotic in your child's poo-poo. So otherwise, growth, appetite, their poo, okay? And the last I would say, everything these three are okay, the child will seldom fall sick, okay? So average, maybe the child might fall sick once in 3 months. But if you send the child to go to school, sometimes the new infection, okay, might make your child fall sick once a month, but usually they recover faster, what we call resilient, okay? Some people will take a week, sometimes your child might take 3 to 5 days. So all these factors, you can judge your child have a good gut health.
Thank you, doctor. So I got this question from this viewer.
All right.
His boy has serious food allergies and eczema. So she's asking whether taking long-term probiotics would be beneficial for the boy.
Okay. Any supplement, in my neutral opinion, unless your child need it, okay, that means have the deficient. For example, your child have anemia, lack of iron, you supplement with iron. Once they achieve everything normal, you can actually stop taking the supplement. Okay, so likewise, the probiotic also the same. Usually, I will give probiotic when your child has this shortage of probiotic. For example, the child suffer from diarrhea, constipation, or maybe the child need to take antibiotic because of the bacterial infection. Then you know antibiotic will kill the good germ because antibiotic will kill the probiotic. So their most important side effect of antibiotic will be diarrhea. So to reduce the risk of antibiotic-induced diarrhea, temporarily I will give a probiotic. Okay. Otherwise, if you ask me, the child is very healthy, had the what I mentioned, the 4 criteria like growth very well, appetite good, poo-poo okay, everything say not much of an infection. You ask me, I will presume your child have a good gut health with plenty of probiotic inside. You might not necessarily to supplement. But another question you mean, let's say the child want to take a long-term probiotic, can or not? Actually okay. In fact, it does no harmful to the body. It's okay. But the thing I will ask you whether it's necessary. There's a keyword.
I see. Some parents would like to mix their probiotics in the milk.
Okay.
So do you think that's a good idea?
Okay. Every probiotic has a label to ask you and teach you how to mix, okay? Some probiotic have to keep in the fridge. If you take out, you must consume. Otherwise, the probiotic will become inactive and they will die, okay? It will confer no benefit to your child. So some probiotic with the technology, they can make it in a spore form, dormant form, can keep in the room temperature. So in such thing, you can swallow directly, or some in a sachet form, you have to dilute it, mix into the new water. You cannot use the boiled water, will kill the probiotic. So follow the instruction at the label.
I see.
Yeah.
Thank you, doctor. Right, we've got a very long question here
Okay.
from Sisulin.
Okay.
Right, so doctor, she has a boy, 2 years old,
All right.
having serious constipation, and he is taking pre and probiotic every single day. Okay,
Alright.
and her Malay friend recommend him to take Chroma together with pre and probiotics. Now she understands that Chroma is very sweet, and she's concerned whether is it a good idea for such combinations.
Okay, kurma is one of the high fiber food to induce the make the stool softer. But before I talking about kurma, the dates, okay, most important you must know the causes of constipation. Usually it's a functional because the child must have a phobia to go to defecate, to strain, okay. So they have this bad memory in mind. They have a phobia. So first thing, seek the medical help. We have to give the child stool softener. In the market, we have a lactulose and Folex kind of thing, depends on the child age. You don't simply give 1 or 2 weeks, the child getting better, you stop immediately. No, you must go for 1 or 2 months, slowly reduce the stool softener. Number 2, at the same time, you must give him a high fiber fruit and vegetables. Okay, fruits will be which I always recommend, the ripened banana, okay, papaya and dragon fruit. You must give a bigger portion, maybe quarter to half, a few portion in a day, okay. Then third, you must train the habit to poo, okay, because you must know this long-term constipation, the child actually hold a lot of the poo at the rectum, left lower corner of the tummy, okay. So the wall of the rectum actually lose the kind of urge to push the poo out. That means they do have an urge of poo, even they have keep maybe 10 or 20 pieces of poo. For normal people, we keep 5 pieces of poo, you have urge want to poo already. So for this kind of case, right, the wall is lax already. So I want you to take the opportunity half an hour after every meal. Our actually gut move very intense. During that time, you encourage the child to sit on the potty with appropriate height. Otherwise, too low also make them sit in difficult. Sit on WC in the toilet also can comfortably with the feet step on the stool. Okay, you try to press and massage the left lower corner. At the same time, give him some reward like sticker, some cold drink like yogurt or fruit juice that induce the gut movement during that time. Maybe for 10 minutes. If the poo-poo doesn't come out, it's okay. Then you do it again for lunch and dinner. Okay, stool softener, fibers, then train the habit. Okay, give some reward. Then fifth, you must have a same objective. That's why I ask you to download the Bristol stool chart. Show your kid, even they don't know how to appreciate the stool, but you can see the picture. Okay, we want the type 4 poo-poo. Okay, not so pain, sometimes even bleeding. Okay, so on top of that, then other high fiber fruit like pearl, pear, apple, even the dates, kurma also can. Of course, kurma a bit sweet because they put some sweetener. Okay, if you think it's very sweet, the child doesn't like and you think it's sweet, then you can take other high fiber fruit which I mentioned just now. Okay, might not be one fruit. Otherwise, the child also will get fed up. Just offer only banana over there. Okay, but one thing, stool softener is a must to relieve the phobia, right? The pain of the child when during the defecation. Yeah.
So we all know that probiotics come in capsule forms,
Yeah.
powder form, or even liquid form.
Yes.
Is there any particular formulation better than the other one?
I think most important depend on your child. If your child is bigger enough to chew, sometimes chewable one they have. Sometimes sachet form they have, but only thing the inconvenient is that you have to mix into the water. Some come with the liquid, you can actually take it directly, right? Which is tasteless and then very convenient. So I think most important the practical point is if you can get a probiotic that which is stable in the room temperature will be good. No need to keep in the fridge because you can take to anywhere when you travel or go other way else. Okay.
Okay. Cool. So let's get our last question here.
All right. Many questions.
Yeah.
Okay.
So from what age can the children start consuming probiotics?
Okay. Probiotic, which I mentioned just now, they have a clinical study. Usually, when you want to study a probiotic or any other medicine, you need the consent from the parents. So some probiotic, right? For example, now I want to do a study on this probiotic. Papa, mommy, can I do this probiotic or whatever medicine on your baby just only 3 months old or 1 year old? No lah, cannot. So you can see some label of any products, not only probiotic, they only put there, okay, 1 year for 1 year and above. So 1 and below can take or not? Can, unless you ask the expert opinion like pediatrician or pharmacist, okay? What we call off-label. Because from our judgment, from our experience, from our knowledge, we know this medicine or probiotic is safe for the children. So if you ask me how old the child, the earliest can take probiotic, you follow the guideline of the label, okay? Let's say 6 months and above, 1 year and above. If below that age, if you want to take, you ask a professional advice.
Thank you, Doctor. That's very important. Always follows the professional's advice, okay?
Yes.
Right. I think that's the end of the sharing section. To the viewers who are joining halfway, remember to answer the question pinned at the comment box below together, and you must stand a chance to win CARiNG cash voucher worth 50 ringgit each, okay? Before we end our session, Doctor, do you have any more advice which you think would be beneficial for our viewers today?
I think most important, the parents, Malaysian parents, right? I know you have many social media to log in, to learn many things, but use your mind, your brain to digest and have a critical thinking and do a good judgment. Don't simply buy whatever supplement, whatever thing without clinical trial, only told by somebody like KOL, like, oh, good lah, even some device to kill bugs, kill COVID whatsoever. I think you must have a good judgment because your children's health lies in your hand. You simply buy things, then you forget your simply SOP or simple one, you get infected. So be a good parent. You must have a lifelong learning on the child health. Like today's platform, I think it's very good. Okay.
Yes, it is very good.
Yeah.
Thank you so much, Doctor. Okay, so thank you everyone who has joined this live, and thank you Dr. Chin for sharing your extensive knowledge with us. I'm sure it has benefited all of us. Okay, again, we would like to apologize for the technical issues earlier today. If there's any question, feel free to refer to our CARiNG Pharmacy Facebook page. Okay, we will always be here for you. All right. As for the viewers anticipating the giveaway, be sure to keep an eye on CARiNG Facebook page, and we will be announcing the winner very soon. Okay. Once again, thank you for joining us this Thursday evening, and see you again in the next live stream. Okay. Bye.
Bye. Thank you, everybody. Yeah.